Elderly patients are becoming an increasing and substantial part of the patient load on the vitreoretinal surgeon, many of whom question whether old age imposes a barrier for surgical intervention and question whether surgery can significantly improve visual acuity. Our study was conducted to evaluate visual and surgical outcomes in the very elderly, above 85 years of age, undergoing a common ocular procedure, vitrectomy, or plana vitrectomy, abbreviated PPV. We carried a retrospective study in our institution and analyzed the medical records of 82 patients who had undergone vitrectomy from the years of 2006 to 2013. Visual results, intraoperative and postoperative complications were the main outcome measures. Mean follow-up was slightly above 7 months. The most common indication for vitrectomy was retinal detachment. The ocular condition necessitating vitrectomy was secondary to trauma, most commonly after a fall, in 12% of the patients. Our main and most significant result was that we validated that in this subgroup of patients, mean visual acuity improved when comparing measures preoperatively to final evaluation with a statistical significance. Interestingly, we found that mean improvement in visual acuity in eyes of patients with a comorbidity of age-related macular degeneration, abbreviated AMD, was 41% lower compared to eyes of patients without the disease. In the subgroup of patients operated for retinal detachment, almost half did not reach primary anatomical success, higher than rates in younger patients when comparing to known literature. Besides failure of reaching surgical goals, our data also suggests that the very elderly are prone to higher complication rates. One or more major ocular complications were reported in 29% of the eyes, while 23 had minor ocular complications, mostly transient. In conclusion, to the best of our knowledge, this is the largest published series describing patients aged 85 years and older that have undergone vitrectomy surgery. Improved visual acuity was documented in more than half of the older adults operated in our institution for various indications. Despite the rates of complications in the very elderly, we believe the possibility of optimizing visual function may positively affect quality of life in this subgroup.